Okay, let's look at the pyramid, the physical side, life. Well, without our physical bodies, we wouldn't be standing or sitting in this room right now. We need these physical bodies, right? Our physical bodies are the temples of our spirit. Temples are sacred places. They need to be cherished and well taken care of. Go into a temple or a church, it's immaculate. They take really good care of it. We need to do that for our bodies. People who take care of their bodies really well are less likely to abuse them. People who abuse their bodies don't take care of their bodies. People who are using are not taking care of their bodies. So we need to take care of our temples. That's where our spirit lives, inside our physical temples. So your physical body is like a vehicle. Now, if you don't give your car the right fuel, it's not going to get you where you want to go. You can scream at it, you can yell at it, you can kick it, you can get depressed about it, you can get anxious about it. It's not going to get you where you want to go because you need to have the right fuel. You put water in your car, you're not going anywhere. You put the right gas in, you're going somewhere. So here's an inflammatory state right here. We all know that. You cut your finger, it gets red and inflamed. Everybody knows what that feels like. It's injury leading to pain, leading to disturbed body function. But there's inflammation on other levels as well. How about inflammation you can't see? How about inflammation in your brain? How about emotional pain that you can't see? When you look at someone, you can't really tell if they have emotional pain. You can't really tell if they have brain fog. You can't really tell if they have disturbed mental function or if they've had a brain trauma. They look kind of normal. But that's all inflammation. And inflammation is discomfort. And discomfort means I want to get out of this discomfort. I want to get out of this uncomfortable state. What can I do fast? And there you go. I'm going to go shopping. I'm going to spend money on the internet. I'm going to go gambling. I'm going to eat too much food of the wrong kind. I'm going to get high. I'm going to do drugs. I'm going to have a drink or more or a bottle of wine. Systemic inflammation is when the body's physiology and biochemistry are out of balance and the body becomes systemically inflamed. Sometimes you can see that. It's hives, it's psoriasis, it's things on your skin, redness, rosacea, things like that. But sometimes it's not visible. You cannot see brain-gut inflammation, and you cannot see mood issues. You can't see them, but they're there. This is a quote from Mark Hyman, who is a very well-known MD. He's the respected author and director of the Center for Functional Medicine at the Cleveland Clinic. He says, most of the chronic inflammation in our bodies is diet-related. In the arteries, it's chronic inflammation and can lead to heart disease. In your joints, it causes swelling and pain. In the gut, inflammation throws off the balance of helpful bacteria and causes direct damage to the lining of the intestines. In the brain, it's linked to anxiety and depression. So from this, we kind of get the idea that we don't want inflammation. Because if we have inflammation systemically, our brain's in our body, it's part of our system, so we're going to have inflammation in our brain. We don't want that because it's linked to anxiety and depression, and neither one of those emotions feel very good. Okay, question time. Which organ in the body has the most serotonin receptors? Anybody know? That's right. Very smart. You're right. It's the gut. People think it's the brain. It's not. It's the gut. Your gut has more serotonin receptors than your brain. That means if your gut isn't healthy or you have gut issues, you have brain issues. You cannot have gut issues without brain issues. And those brain issues are anxiety, depression, memory loss, brain fog, even OCD, things like that. It is the gut, for sure. So if you have a healthy gut, you have a healthy brain. You have better mood. Better mood means less self-medication with substances or activities. It also means less drug, alcohol, and food use. So poor diet. I know we're not all eating those donuts, but that's just an example of a bit of poor diet. Leads to systemic inflammation, your whole body, including your brain. Leads to brain and gut inflammation. Leads to anxiety and depression. leads to drug and alcohol and behaviors that are addictive behaviors. There's no way this is not connected to that. There's no way this is not connected to that. There's no way this is not connected to that, that, and that. It's all connected. Let's talk about the thyroid. My stepfather was a brilliant psychiatrist. He was actually the head of the mental health and addiction program at Montgomery County Hospital in Olney, Maryland. And after a while, he just did a private practice, and then after a while, he decided to just do locum tenens, which is when you kind of go to a certain location, usually a psychiatric hospital, for a month or two, up to 6 months, where you work there as a consultant. So he was doing that. And he knows my passion about thyroid and the immense amount of research and energy I put into thyroid disorders connected to brain and mood. And he told me that thyroid abnormalities were very common among psychiatric patients. And he told me that when they ran thyroid tests on those patients, most of them had out of balance thyroid. And when the thyroid was balanced out, the depression, the anxiety, the bipolar, and a lot of those symptoms stabilized and disappeared. They didn't need Thorazine. They needed thyroid medication. They needed their thyroid addressed. He said those were the tests that they ran to rule out that. It's often not done. In my office, I believe it's important when someone comes in and they're not feeling well, especially with anxiety and depression. I run a full thyroid panel. They can't get this from their doctor. Their doctor, I don't know, they just run a TSH, and if you're lucky, you get a free T3 and a free T4. I run a full thyroid panel, including the antibodies. The antibodies show the level of inflammation, and there's a direct connection between that level of inflammation and brain function and mood and foggy thinking. Anxiety, depression, body pain, and brain function issues are present when the thyroid is out of balance. Those are the things that lead people to engage in behaviors, addictive behaviors, or substances to feel better. Nobody wants to feel bad. They want to feel better. 95% of low thyroid or hypothyroid is autoimmune thyroid known as Hashimoto's. But people don't know they have it. Why? They don't know they have it because there's no drug for it. So you go to the doctor and you might find out, oh, your TSH is a little high, which actually means your thyroid is low. It's kind of counterintuitive, but that's the way it works. So your TSH is high, so you're low thyroid, so you're hypothyroid, and maybe you get a thyroid medication. But your antibodies are never checked because they don't have a drug for that. However, functional medicine does have the remedies. The remedies are diet, intervention, lifestyle modification. And those are the things that can actually heal a person who has Hashimoto's. And if those things aren't addressed, it's just one med after the next, one SSRI after the next, one anti-anxiety med after the next, trying to get themselves to feel better, when it's like barking up the wrong tree, as far as I'm concerned, because it's missing the point. It's not looking at what is going on that's creating the disturbances. Why is the thyroid low? Well, the thyroid's low because the antibodies are out of whack. Also with Hashimoto's, there's something to keep in mind. The TSH goes up and down. So the person might be feeling really, really tired one day, and then they might be really speedy and anxious the next day, or having hot flashes. A lot of women have actually underlying thyroid issues. They don't know it. They think they have menopausal issues. And so it's really important that a full thyroid exam be done with the antibodies to find out what's really going on before they start getting into hormones. My opinion. And the opinion of functional medicine, by the way. Food sensitivities are also connected to gut and thyroid issues, and they cause inflammation. But you don't know it sometimes because you might eat something and say, wow, I just had that ice cream, I feel fabulous. My stomach feels great. And then 3 days later, you have this incredible depression and you're crying all the time, and you don't know why. It's because sometimes it takes 3 to 5 days. 3 to 5 days to have a response to a food that you were sensitive to. And you can't really track back. I mean, if I asked you what you ate yesterday, you probably won't remember, let alone 5 days ago, unless you're keeping track of it. So that's a big component with thyroid issues and systemic inflammation. Remember, systemic inflammation is what causes people to want to use to moderate their mood. But I don't have anxiety. So I had this wonderful young woman in my office recently, and I said, do you ever feel anxious? And she says, no, I don't actually have anxiety. But she has a drinking problem and a weight problem. So I said, well, when are you drinking? She goes, well, I'm not really anxious. It's just like when I'm with a group of friends and I feel kind of awkward, or like I'm not part of the group, or maybe I'm bored, or I just don't feel comfortable in my own skin and I'm self-conscious about my weight. And this is anxiety right here. A feeling of worry, nervousness, or unease, typically about an imminent event or something with an uncertain outcome. Well, hey, that's kind of life, isn't it? We don't know what's going to happen tomorrow. An uncertain outcome. This is what she was eating. Her healthy diet, which she was very proud of because she was trying to lose weight. Breakfast was coffee and a bagel. Lunch was a nice salad from usually fast food with some cheese on it. And dinner was pasta with Parmesan cheese and some grilled vegetables. Not so bad, right? It's bad. Here's why it's bad. These are all inflammatory foods. This particular girl had siblings in her family that were all on medication for depression or anxiety. I tested 2 of her siblings and they had Hashimoto's. She had Hashimoto's when we ran her blood tests. She also had type 2 diabetes in her family. So there was meds for that, SSRIs, anti-anxiety meds, and thyroid meds. And here she was. How much protein is in that meal of the day? Not much. And inflammation, bread and dairy. Inflammation, the sweeteners and whatever was in that drink. Inflammation, cheese. Inflammation, grain. So she, without realizing it, was exacerbating and contributing to her anxiety. She didn't know it. She thought her diet was healthy. Most of the people that come in to see me are very proud of how they've been eating. And they think they've been eating really healthy. But remember, functional medicine is everyone is unique. What's healthy for you may not be healthy for you. The trick is to do what's right for you. Let's go back to the physical pyramid. Free of inflammation. We want our bodies to be free of inflammation. We want to nurture and cherish our bodies. We have to have adequate pure water intake, adequate sleep, and have physical movement and exercise. How much water should we be drinking? Pure water. Anybody know?
1/3 of your body weight in ounces.
How much?
1/3 of your body weight in ounces.
Half.
Half
Your body weight in ounces. Thank you. Half your body weight in ounces. So if you weigh 150 pounds, 75 ounces of water. Coffee doesn't count. Tea doesn't count. Fruit doesn't count. Just the water. Half your body weight in ounces. And movement. You don't have to be working out at the gym 3 hours a day. You can go up and down the stairs in your house a few times. Go out and take a walk. Moving your body every day, get your electricity going.